Tony Evers.
Thank you. Good afternoon, everyone, and thanks for joining us today. This week, we reached an unfortunate milestone. Every county in Wisconsin has now reported at least one case of COVID-19. This disease is impacting every corner of the state, and we now have fewer tools at our disposal to help mitigate the spread. That means it is more important than ever that Wisconsinites answer the call to stay safer at home as much as you can, wear a mask in public, and practice good hygiene and social distancing. If you're a business owner, it means following the best safety practices to keep your workers and your customers and communities healthy and safe. Wisconsin Economic Development Corporation has released comprehensive guidelines to help businesses make these good decisions, and I urge everyone to take a look at these resources. The COVID-19 pandemic has hit Wisconsinites hard, physically, emotionally, and financially, and we all must do our part to get through this crisis and get back to our Wisconsin way of life. With the passage of the CARES Act, the federal government authorized over $2 trillion in relief to address the public health and economic impact of COVID-19. Wisconsin's share of the CARES Act is $2 billion. This relief is sorely needed. Prior to COVID-19, Wisconsin's economy was strong. In fact, we are seeing a steady decline of the unemployment rate this year to near record lows. COVID-19 has changed that. Wisconsin's unemployment rate in April was 14.1%. The Department of Workforce Development is taking significant steps to meet the needs of Wisconsinites. They have expanded their hours, and they're adding up to 1,300 staff, including contractors, state employee transfers, and new hires. I know that for folks who are waiting and struggling, this is an incredibly and frustrating, difficult time. Our staff is working around the clock to help get these benefits paid out as soon as they possibly can. Everyone who is eligible for benefits will receive the benefits they have earned. We'll get our economy working again, but we need to be smart, safe, and follow the lead of science. The $2 billion in CARES Act funding Wisconsin has received will help jumpstart our recovery. This week, we made some major announcements on how we're putting those dollars to good use. As we make funding decisions, we are ensuring these dollars go where they are most needed. Earlier this week, we announced a $1 billion investment in testing, contact tracing, and support for local governments that is needed to stop the spread and box in this virus. We're also using these funds to bolster our supplies of personal protective equipment for our healthcare workers, first responders, and local governments so that they can do their jobs safely, and we're investing in ventilators and other patient care efforts. To jumpstart our economy, we announced a $75 million small business grant program that will provide assistance to Wisconsin's Main Street businesses with the expectation they uphold and follow health and safety recommendations to protect workers, consumers, and their communities. This will help, but we know that many Wisconsinites are struggling to make ends meet and keep a roof over their heads. That's why we're also investing $25 million in Wisconsin Rental Assistance Program to provide up to $3,000 of assistance to eligible renters to prevent evictions and to ensure housing stability. We also announced a $50 million investment in direct payments to Wisconsin farmers, as well as a $15 million investment in combating food insecurity across our state. This plan is a win-win as we're connecting the high-quality food that our farmers produce with the people who need it most. And today, I'm excited to announce a $100 million grant program to support long-term care facilities, home and community-based services, and emergency medical services. We recognize the significant burden that the COVID-19 response has placed on these providers. We also recognize the integral role they play ensuring the health and safety of some of our most vulnerable Wisconsinites, and we want to support their efforts during this pandemic. The program will be administered in two parts, an initial phase of funds to support immediate needs, and a second targeted release for additional needs of individual providers. Both rounds of funding will be allocated to support expenses directly related to COVID-19, as well as expenses associated with the interruption of typical operations such as overtime pay, changes to sanitarian procedures, and disruption to the standard delivery of care. Emergency medical service providers have been on the front lines in their communities responding to COVID-19. Long-term care facilities and home and community-based service providers are ensuring the elderly and people with disabilities can stay healthy and safe in their own homes and communities. These providers are experiencing significant challenges as pandemic-related expenses like purchasing necessary PPE and retaining workers have increased operating costs. This funding will make it possible for this network to continue providing their essential services, protecting many of those most at risk from the virus. Now, these are all important programs that will help move the needle, but this funding is just an initial investment in what's needed to get us back on track. We need the federal government to come back to the table to provide continued relief for state and local governments that have been shouldering the economic burden of the response to this pandemic. This pandemic has also shined a light on existing inequities in our state and nation. So as we move toward recovery, we must use every tool we have to ensure we're creating a more equitable and sustainable state for all Wisconsinites. Wisconsin must be a state where nobody gets left behind and where everybody is valued, especially in this scary and uncertain time. It's completely understandable to be afraid. Fear is a normal reaction to a pandemic, but hate is not. In recent weeks, we have seen a spike in hateful actions and language against Asian Americans on a national and state level. Our Asian American community deserves our support, just as any community in our state deserves our support. No one is at fault for this virus. This virus does not discriminate, and it does not give an excuse for people to either. These actions hurt your neighbors and friends and family, even if you don't realize it, because we are all in this together, and if any one of us is unsafe, that affects our entire state. In the middle of this pandemic, we are already worried about our health and safety. So much is uncertain, but one of the things we should be able to rely on is Wisconsin's support for one another. COVID-19 is a crisis for our state and our country, and a crisis can cause people to come together or can cause them to break apart. I know that we are better together, Wisconsin. We are better than fear and hate and anger. Wisconsin, I'm asking you to come together to bond in our common goal of safety and health and recovery, and to reject hateful actions. It is the best and only way forward. When Wisconsinites come together, we can make great things happen. Let's all do our part to box in this virus, keep our communities safe, care for one another, and get back to our Wisconsin way of life. And now, before Secretary-designee Andrea Palm gives her daily update, I'd like to let you hear from one of those healthcare workers on the front lines, Katil Smith, ADN, employee at St. Paul Elder Services, Inc. Take it away, Katil.
Thank you, Governor. Good afternoon. My name is Katil Smith, and I'm proud to work for a long-term care facility that was as prepared as any for a pandemic like the coronavirus. Our staff know why each protocol is necessary, how we execute each one properly and effectively, and how they contribute to our overall goal of protecting ourselves as healthcare workers, our residents and patients, and our organization as a whole. We are participating in the all staff and resident testing that the state is providing for us, and we need that type of support and coverage of testing on an ongoing basis. We have had 2 positive cases between our campuses, and we have successfully done our job in ensuring that those individuals did not spread their infections to others. Long-term care facilities have a whole lot of infection control competence and skill, but we also have a commitment to doing what is best for those we serve. As a caregiver, I have the privilege of having conversations and hearing our residents' feelings as I serve them during this difficult time. Their voices are full of gratitude, but I also hear the worry and the fear, the possible reality that they will not see their family again until they are dying. They are counting on us all to do our part to allow them to see their loved ones again, sooner rather than later. As much as our residents miss having their friends and family come and go freely, miss embracing their children and holding their grandchildren, they know that the safest thing for them is to remain sheltered here from the illness transmission that may be occurring amongst the public in our communities. They absolutely understand the regional and statewide approach to resuming normalcy may have disproportionate impacts on them. They want to know that the communities they live in and contribute to are coming together in ways that will protect them. They know that the greatest risk for an outbreak is that we as staff may pick up this virus in our communities and unknowingly bring it through our doors, or that as we reopen, a visitor may do the same. They want to know that people care enough about their lives that everyone is taking all of the recommended precautions to mitigate the risk that this virus comes through our doors, which we know includes masking in public, ongoing physical distancing, and staying home when sick. They also want to know that the government is providing the funding and resources needed to us as their healthcare providers to be able to do regular testing, to acquire all needed PPE, and to retain the staff needed to implement best practice infection control systems. The phrase, "it takes a village," could never be truer. Our residents have been made to feel at times that their lives are expendable, and I can speak for every caregiver in this state when I say with my whole heart that they are not. These are your moms and dads, grandmas and grandpas, friends, sisters, brothers. They have stories and legacies and life to live yet. As a frontline caregiver, I'm making ongoing sacrifices that others are not. I'm not going to dinner with my friends. I'm not allowing my children to have play dates. I'm not going to the salon for services that I typically would. I'm wearing a mask when I go to the grocery store to avoiding situations that present the risk for exposure. Again, I know I speak for my peers when I say that I do not want to be the person who unintentionally brings this awful virus through our doors. Our residents need us, and they need us to be healthy. But as long-term care staff, we are a small part of the broader community, and we should not shoulder all of the responsibility for keeping this virus out of our facilities. This is a public health crisis that requires so much more than our individual sacrifices. We will continue to fight for every resource we need to protect the lives of those we serve, because we will not let loss of life in our facilities become an expected or acceptable outcome. Each person impacted by this virus has a name. They have a family and a story behind it, and we won't compromise and risk losing even one. Thank you so much for the opportunity to speak on behalf of Wisconsin's long-term care workforce and the residents and patients we so desperately seek to protect during this crisis. I will now send it back to Secretary-Designee Andrea Palm.
Thank you, Katil, for sharing your story and for the incredible work you and all of your colleagues are doing with some of our most vulnerable neighbors, friends, and family members. The Wisconsinites working in our long-term care facilities are on the front lines of the COVID-19 pandemic, and we want to support them as much as possible. I've seen the stories of young people writing letters to grandparents and families hanging hearts in their windows, and it's very moving to see so many of you taking action to show your support. Actions like these help our frontline workers like Katil build resilience as a community. Building resilience, the ability to bounce back from adversity, is key for our healthcare providers, and it is also integral to our own health as individuals. During this pandemic, it makes sense to pay attention to our physical health. And if you have symptoms of COVID-19, please get tested. But we also need to pay attention to our mental and emotional health and ask for help when we need it. This is why Governor Evers issued a proclamation declaring May Resilient Wisconsin Month, and it is why we are expanding our Resilient Wisconsin initiative at DHS. Resilient Wisconsin is designed to provide tools and resources for reducing stress and dealing with the emotional challenges of this pandemic. We have added content specific to Wisconsinites who may be experiencing especially high levels of stress due to COVID-19. Frontline workers and their families, people facing elevated health risks, and disrupted workers and their families. If you're looking for support or want to explore these resources because you're worried about a friend or family member, please visit resilient.wisconsin.gov. Our mission at DHS is to protect and promote your health and well-being. That includes both your physical and your emotional health. They're interconnected and both deserve attention and care. And remember, it is okay to ask for help. So I'll end today with an update on the numbers and a couple of reminders. Here's where we stand. We have 53 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 14,140 tests. We have 163,238 negative tests, which is an increase of 8,938. And we now have 13,885 positive cases of COVID-19 in Wisconsin, an increase of 472 people. Our total deaths have now reached 487. So for the reminders, if you're experiencing any symptoms of COVID-19, please get a test. The first step is to call your healthcare provider. The DHS website also lists the locations of community-based testing sites, and I'd encourage you to check back frequently as we add testing sites on an ongoing basis. Remember, if you test positive, you'll receive a call from a contact tracer. Contact tracing is critical to our boxing in the virus, and your willingness to pick up the phone and help with this piece of our state's response to COVID-19 is essential to our success. Thank you, Wisconsin, for all the work you're doing and will continue to do.